Welcome to another practice question video. At the end of the video, sign up for free daily practice questions and free bonus nursing printables. Now let's begin. Starting with question 1. A male client with primary diabetes insipidus is ready for discharge on desmopressin. Which instruction should the nurse provide? A. Administer desmopressin while the suspension is cold. B. Your condition isn't chronic, so you won't need to wear a medical identification bracelet. C. You may not be able to use desmopressin nasally if you have nasal discharge or blockage. D. You won't need to monitor your fluid intake and output after you start taking desmopressin. The correct answer is you may not be able to use desmopressin nasally if you have nasal discharge or blockage. Desmopressin may not be absorbed if the intranasal route is compromised. Desmopressin administration can be utilized to distinguish between central versus nephrogenic diabetes insipidus, with a positive response noted in central diabetes insipidus, meaning the kidneys respond appropriately to desmopressin with the expected concentration of the urine and increased reabsorption of fluids, resulting in eutonic urine. The nurse is assessing a client after a thyroidectomy. The assessment reveals muscle twitching and tingling, along with numbness in the fingers, toes, and mouth area. The nurse should suspect which complication? A. Tetany. B. Hemorrhage. C. Thyroid storm. D. Laryngeal nerve damage. The correct answer is tetany. Tetany may result if the parathyroid glands are excised or damaged during thyroid surgery. Hypoparathyroidism results in hypocalcemia, which may become symptomatic and life-threatening. Criteria for hyperparathyroidism have not been clearly established, but the reported incidence is approximately 1/3, with the majority of these being temporary. It is important to maintain a consistent protocol for calcium management after total or completion thyroidectomy to minimize related complications. Early this morning, a female client had a subtotal thyroidectomy. During evening rounds, Nurse Rebecca assesses the client, who now has nausea, a temperature of 109 degrees Fahrenheit, tachycardia, and extreme restlessness. What is the most likely cause of these signs? A. Diabetic ketoacidosis. B. Hypoglycemia. C. Thyroid crisis. D. Tetany. The correct answer is thyroid crisis. Thyroid crisis usually occurs in the first 12 hours after thyroidectomy and causes exaggerated signs of hyperthyroidism, such as high fever, tachycardia, and extreme restlessness. Presentation of thyroid storm is an exaggerated manifestation of hyperthyroidism, with the presence of an acute precipitating factor. Fever, cardiovascular involvement, including tachycardia, heart failure, arrhythmia, central nervous system, CNS, manifestations, and gastrointestinal symptoms are common. Which outcome indicates that treatment of a male client with diabetes insipidus has been effective? A. Fluid intake is less than 2,500 milliliters per day. B. Urine output measures more than 200 milliliters per hour. C. Blood pressure is 90/50 mm Hg. D. The heart rate is 126 beats/minute. The correct answer is a fluid intake is less than 2,500 milliliters per day. Diabetes insipidus is characterized by polyuria, up to 8 L/day, constant thirst, and an unusually high oral intake of fluids. Treatment with the appropriate drug should decrease both oral fluid intake and urine output. It is essential to replete fluid losses in diabetes insipidus, as some patients may have thirst impairment and will not respond adequately to water intake. A female client with a history of hypothyroidism is brought to the emergency department by the rescue squad. Physical and laboratory findings reveal hypothermia, hypoventilation, respiratory acidosis, bradycardia, hypotension, and non-pitting edema of the face and pretibial area. What is an emergency action to prevent the potential complication of? A. Thyroid storm. B. Cretinism. C. Myxedema coma. D. Hashimoto's thyroiditis. The correct answer is myxedema coma. Severe hypothyroidism may result in myxedema coma, in which a drastic drop in the metabolic rate causes decreased vital signs, hypoventilation, possibly leading to respiratory acidosis, and non-pitting edema. Patients are most commonly presenting for emergency services with altered mental status and hypothermia, below 35.5 degrees Celsius (95.9 degrees Fahrenheit). The lower the body temperature, the worse is the prognosis. The absence of mild diastolic hypertension in severely hypothyroid patients is a warning sign of impending myxedema coma. Following myocardial infarction, a hospitalized patient is encouraged to practice frequent leg exercises and ambulate in the hallway as directed by his physician. Which of the following choices reflects the purpose of exercise for this patient? A. Increases fitness and prevents future heart attacks. B. Prevents bed sores. C. Prevents DVT, deep vein thrombosis. D. Prevent constipations. The correct answer is prevents DVT. Exercise is important for all hospitalized patients to prevent deep vein thrombosis. Muscular contraction promotes venous return and prevents hemostasis in the lower extremities. A patient received surgery and chemotherapy for colon cancer, completing therapy 3 months previously, and she is now in remission. She now complains of fatigue following activity and difficulty with concentration at her weekly bridge games. Which of the following explanations would account for her symptoms? A. The symptoms may be the result of anemia caused by chemotherapy. B. The patient may be immunosuppressed. C. The patient may be depressed. D. The patient may be dehydrated. The correct answer is the symptoms may be the result of anemia caused by chemotherapy. 3 months after surgery and chemotherapy, the patient is likely to be feeling the after effects, which often includes anemia because of bone marrow suppression. A nurse is caring for patients in the oncology unit. Which of the following is the most important nursing action when caring for a neutropenic patient? A. Change the disposable mask immediately after use. B. Change gloves immediately after use. C. Minimize patient contact. D. Minimize conversation with the patient. The correct answer is change gloves immediately after use. The neutropenic patient is at risk of infection. Changing gloves immediately after use protects patients from contamination with organisms picked up on hospital surfaces. This contamination can have serious consequences for an immunocompromised patient. A client with acute leukemia is admitted to the oncology unit. Which of the following would be most important for the nurse to inquire? A. Have you noticed a change in sleeping habits recently? B. Have you had a respiratory infection in the last 6 months? C. Have you lost weight recently? D. Have you noticed changes in your alertness? The correct answer is have you had a respiratory infection in the last 6 months? The client with leukemia is at risk for infection and has often had recurrent respiratory infections during the previous 6 months. Corticosteroids are potent suppressors of the body's inflammatory response. Which of the following conditions or actions do they suppress? A. Cushing syndrome. B. Pain receptors. C. Immune response. D. Neural transmission. The correct answer is immune response. Corticosteroids suppress eosinophils, lymphocytes, and natural killer cells, inhibiting the natural inflammatory process in an infected or injured part of the body. This helps resolve inflammation, stabilizes lysosomal membranes, decreases capillary permeability, and depresses phagocytosis of tissues by white blood cells, thus blocking the release of more inflammatory materials. Well, that's it with this video. See you next week for another set of questions. Leave a comment saying how many you got correct.